Kidney infections, causes and prevention. Kidney infections can occur when bacteria from the urinary tract travel up the urethra and affect one or both kidneys. Sometimes the bacteria that cause kidney or renal infections come from another part of the urinary tract, such as the bladder, ureters or urethra. Kidney infections most commonly affect people who already have a bladder infection, females, and those who are pregnant. People who experience symptoms of a kidney infection should seek medical attention as soon as possible, as the condition may cause permanent kidney damage or spread to other parts of the body. This video will explain the causes of a kidney infection and the prevention method. Signs and symptoms of a kidney infection. According to the United Kingdom's National Health Service, kidney infections usually develop within a few hours. Kidney infection symptoms include diarrhea, nausea and vomiting, chills or shivering, lower back pain, pain in the groin, pain in the side, fever. The National Health Service notes people may also experience symptoms similar to a urinary tract infection. Symptoms may include pain or difficulty while urinating, which may feel like a burning or stinging sensation. Other symptoms can include bloody urine, cloudy urine, foul-smelling urine, frequent urination, inability to fully empty the bladder, pain in the lower abdomen, confusion. Causes of a kidney infection. A kidney infection develops due to bacteria or viruses entering the urethra and reproducing in the bladder, triggering an infection. Typically, a kidney infection results from a bladder infection that travels to the kidneys. An infection may happen when pathogens transfer from the bowel to the genitals during sexual intercourse or through accidental transference of feces to the urethra while wiping with toilet paper after a bowel movement. The American Kidney Fund notes that risk factors of kidney infection include kidney stones, having a urinary catheter, an enlarged prostate in males, having a urinary tract shaped in a way where urine may not pass through easily, having vesiculateral reflux, where the urinary tract allows urine to flow back up into the ureters, pregnancy, diabetes, a weakened immune system because of medication or a medical condition, a spinal cord injury or nerve damage that could block symptoms of a bladder infection. Treatment for a kidney infection. If a person suspects they have a kidney infection, their doctor or another healthcare professional will likely recommend a urine test. The usual course of treatment for a kidney infection is antibiotics, though some people require other forms of treatment. Antibiotics. If a person's symptoms suggest an infection, a doctor may prescribe antibiotics before the test results return. A person may also take pain relief. It is essential to finish the whole course of antibiotics. When test results return, the healthcare professional may change the antibiotic to one that will treat the infection more effectively. Fluids. When a person has a kidney infection, it is essential to consume plenty of fluids to help prevent fever and dehydration. Fluid intake recommendations may vary depending on the type of infection. Hospital treatment. A person whose symptoms are not improving or who has more severe symptoms may require treatment in the hospital. Some people may need intravenous antibiotic treatment through a vein in their arm. If a person experiences dehydration, fluids may be administered with a drip. According to the National Health Service, people will stay in the hospital for 3 to 7 days. Surgery. A person who has a kidney stone or enlarged prostate that is blocking their urinary tract may require treatment through surgery. Preventing a kidney infection. Often, a kidney infection results from a pre-existing infection in the urinary tract. The best way to help prevent a kidney infection is by taking steps to help avoid an infection in the urethra or bladder. The American Kidney Fund offers some tips to help prevent a kidney infection. This include hydration. Drink plenty of fluids, particularly water. Urination. Urinate whenever there is an urge. Do not wait. Sexual intercourse. Urinate after sexual intercourse. Wash the genitals before and after intercourse. Hygiene. Wash the genitals every day. Do not use deodorant, sprays or a douche on the genitals. Toilet hygiene. After passing stools, wipe the anus from front to back. This reduces the risk of spreading bacteria to the genitals. Fiber. Eat plenty of fiber so that stools pass easily and do not cause irritation or skin lesions. Constipation increases the risk of developing a kidney infection. When to contact a doctor? A person who does not seek medical advice could develop serious complications. Contact a healthcare professional if a person is experiencing persistent or severe pain in the mid to low back or side, feeling shivery or has a fever, confused, breathing rapidly or has a high heart rate, experiencing shortness of breath. Diagnosis of a kidney infection. A medical professional will usually check a person's medical history for health conditions that linked to a kidney infection. Diagnostic procedures may include physical examination. A medical professional will conduct a physical examination, checking a person's general state of health, including heart rate, blood pressure, temperature, signs of dehydration, and respiratory rate. A healthcare professional will assess the mid to lower back for pain, sensitivity, or tenderness. Rectal examination. If a person is male, a medical professional may carry out a digital rectal examination to check for an enlarged prostate blocking the neck of the bladder. Pelvic examination. If the person is a young female, the doctor may carry out a pelvic examination to verify whether there is any pelvic inflammatory disease. A female may also need to take a pregnancy test. Urine sample. A person will collect a midstream urine sample in a special container for lab analysis. If the urine sample contains bacteria and white blood cells, it could indicate an infection. Both symptoms and lab results can help in diagnosis. Imaging. A healthcare professional may request imaging of the kidney area, such as a CT scan, MRI scan, or ultrasound.